A few of the indications for an arterial blood gas sampling are sudden unexplained dyspnea, cyanosis, abnormal breath sounds, severe unexplained tachypnea, heavy use of accessory muscles, vent setting changes, acute hypotension, CPR, and new infiltrates in the chest x-ray.
Alrighty, contraindications for an ABG is a failed Allen's test. You need to find a different puncture site. So if you do it on the right hand, you need to switch to the left. It can't be performed on a limb with a distal surgical shunt or lesion. Need for monitoring the femoral puncture site for extended periods of time, which means you should not be performing ABGs outside the hospital. Anticoagulation therapy such as heparin or warfarin are a relative contraindication.
A few of the precautions and possible complications of an ABG are arteriospasm, hemorrhage, air or clotted blood emboli, trauma to the blood vessel, anaphylaxis from local anesthetic, arterial occlusion, patient or sampler contamination, vasovagal response, hematoma, and pain.
When assessing the need for an ABG, some of the things you want to look for are the history of smoking, the recent onset of difficulty breathing or trauma, abnormal diagnostic tests such as a pulse ox or a chest x-ray, the initiation, change, or discontinuation of a therapy such as O2 therapy or mechanical ventilation. A few things that need to be monitored after taking an ABG are the FiO2 of the patient, the respiratory rate, proper application of O2 device, temperature, mode of vent support and settings, pulsatile blood return, patient appearance, air bubble or clot in syringe or sample, ease or difficulty obtaining a sample, and the puncture site appearance.
These big droids.
Alrighty, for an ABG, you want to get the arm set up. Sometimes you can use a towel to overextend it, but here we're good. First, you want to feel for the pulse. Once you find where you want to puncture, you're going to take your alcohol swab, clean it off. You're going to get your needle ready. Make sure it's on, bubbles up. You're going to want your gauze pad right next to you. And then you're going to feel for your pulse again. And you're going to go in at a 45-degree angle, bevel up. And you're going to see a flash as soon as you hit the artery. And then you're going to watch it fill up itself. When you got it to where you want it, pull the needle out. Stick it there. Apply pressure until the bleeding stops. There's usually a band-aid that you can put over top, or just take tape and the gauze. Leave it on for about an hour, hour and a half, and then you can take it off. And then after you do that, you're going to take the needle out, put the other cap on, flick to make sure you have all the air bubbles out, push it up, and send it down with your sample bags.
Okay, so the normal ABG values are a pH of 735 to 745, a PaCO2 of 45 to 35, a PaO2 of 80 to 100, a bicarb of 22 to 26, an O2 saturation of 95 to 100%. If your pH, PaCO2, PaO2, and bicarb are on the lower side of the normal value, it will be considered acidotic. If it is on the higher side of the normal values, it is considered alkalotic. So I have an example up on the board of an ABG. Your pH is 727, your CO2 is 53, your PaO2 is 50, your O2 saturation is 79, and your bicarb is 24. So 727 is on the lower end, so that would be considered acidotic. Your CO2 is on the lower end, which would be considered acidotic. Your O2 is 50, which is lower than 80 to 100, so that is considered low. Your O2 saturation is 79, which is low, and your bicarb is at a normal value. So, if you look at this example, your problems are your pH and your CO2, which would be a respiratory problem. So if you look down at your bicarb, it's normal, so it's not doing anything to make the pH and the CO2 values better, so it would be considered uncompensated, not doing anything. A respiratory acidosis, and if you look at your O2 and your oxygen saturation, they are both low, so it would be an uncompensated respiratory acidosis with hypoxemia.